పెద్దగా చేసారా? నాకు ఈ డివైస్ తీసి ఇవ్వరా?
ఓకే,
అంతేనా?
అంటే తీసేయటం.
అంతేనా? పెద్దగా చేసారా? Good morning everyone. Today we are going to talk about contraceptive methods because it's also important in examination point of view. Okay, let's start. So what's a contraceptive method? A contraceptive method is one which helps the women avoid unwanted pregnancy resulting from coitus. Okay, so there are some temporary methods and some permanent methods which will prevent the pregnancy resulting from intercourse. So, is there any ideal contraceptive? I don't think there is any. Each contraceptive has got its own advantages and disadvantages. So, let's see one by one. And what is cafeteria choice? When couple comes to a doctor or a physician, they are told about all the methods and their advantages and disadvantages. And the couple should decide which one they need to use. So same thing, why cafeteria? When you go to a cafeteria or a hotel or a place, you are given a menu and you select from that. Same way you tell everything to the couple and the couple gets to choose the ideal contraceptive for themselves. That is why it is called cafeteria choice. What should be an ideal contraceptive? Ideal contraceptive should be one which is safe, which is effective, which is affordable, and important. Once they stop taking it, it should be reversible and it should be reliable. It should be a very simple method to use. So that is an ideal contraceptive. Next slide. So what are the contraceptive measures? Now let us see the contraceptive measures in males and contraceptive measures in females. So why is it called a conventional method? So whatever needs action at the time of intercourse, that is why they are called conventional methods. Conventional methods, they need action at the time of intercourse. That is why they are called conventional methods. The most common one all over the world, it is a condom. It's a barrier device. And in India, by name Nirod, it comes into the market by name Nirod. Nirod is a Sanskrit word which means prevention. Okay. So it is made up of a latex sheath. It's a sort of plastic. So what are the advantages of this method? It is easily available. It is safe and inexpensive. It is easy to use. We don't need any medical supervision. It has no side effects. It is light. You can put it in a pocket and move about. Light, compact and disposable. It provides, the most important one about this condom is it provides protection not only against pregnancy but also against sexually transmitted diseases. So this is the biggest advantage of the condom. Okay, now let's see what are the disadvantages. Disadvantages are it may slip off or tear during coitus due to incorrect use, interfere with sex sensation locally, about which some people complain while others get used to it. A new condom should be used for each sexual act. So these are the disadvantages. Coming to the next one is the coitus interruptus. What is coitus interruptus? Ejaculation, withdrawal of penis before ejaculation is coitus interruptus. So biggest disadvantage of this is if the timing is wrong and even a drop of semen is enough to cause pregnancy. This is coitus interruptus. Okay, vasectomy. It's a permanent method where the vas deferens is ligated and sectioned, and that advantage is it's a permanent method. Disadvantage is people they develop antibodies. Antibodies are developed after this vasectomy, and if they want to restore fertility at a later date, only successful rate is 50%. Success rate is only 50%. Okay, drugs. Administration of testosterone in high doses decreases the sperm count. So, testosterone, if it is administered in very high doses, it will act on the hypothalamus and it will inhibit the release of LH or IC interstitial cell stimulating hormone from the pituitary by inhibiting the GnRH release from the hypothalamus. Okay, gonadotrophin releasing hormone by inhibiting gonadotrophin releasing hormone from the hypothalamus. So, what are the disadvantages of this method? Testosterone in such a high content is said to be toxic, number one, and the second thing is it has got sodium and water retention capability. So, these are the disadvantages of administration of high dose of testosterone. Next one, these are the methods in males. So, in the methods in males, what have we seen? Conventional method like condom, coitus interruptus, vasectomy and drugs. Now coming to contraceptive measures in females, the conventional methods. So conventional method means it's just before the intercourse the woman has to put it, and after the intercourse she should keep it for 6 hours. This is diaphragm. So diaphragm is also same material like that of condom. It is also made up of type of plastic, latex sheath made up of plastic, and women should be fitted of the correct size diaphragm, and it is held in place partly because of the spring tension and also partly because of the vaginal tone of the muscles. So it is held in place, and she should, before the intercourse, women has to insert this into her vagina, and 6 hours she should keep it after the intercourse. What are the disadvantages of this? A trained person is needed. First, a physician or a trained person will show the technique how it has to be used. So a trained person is needed. Then involution of uterus. Immediately after pregnancy, if you keep this diaphragm, it will be coming out. So we have to wait till the involution of the uterus, then only this method can be tried. And local infection, because keeping for 6 hours it can result in local infection. These are the disadvantages of this method. Next one. Cervical cap. It is same like your diaphragm, but the size is smaller than that of the diaphragm. Okay. Third one, chemical methods. Chemical methods are foams, creams, jellies, some paste, suppositories. All these devices are impregnated with spermicides. These are all surface active agents, and when this cream or jelly or whatever it is put on the cervical cap or diaphragm, it acts as a double protection. So usually this method is better than using only the diaphragm. Okay, they are all impregnated with spermicides. They are all surface active agents. So whenever the sperm comes in contact with this foam or paste or whatever it is, it will inhibit the oxygen uptake and the sperm will die. That is how its action. So what are the disadvantages? High failure rate. It has got high failure rate. It should be used immediately before each act. Introduced into vagina where sperms are likely to be deposited. You have to put this cream in the vagina where the sperms are likely to be deposited. Mild burning. It can cause mild burning or irritation. It is best with the barrier method. So as I told you, it is best with conjunction with other method like your diaphragm or cervical cap, and it is a question mark whether it has a very teratogenic effect on the fetus. It has not been proved yet, but it's a query. Okay, so these are the disadvantages of female methods. Okay, rhythm method. As you all know, rhythm method. So have sex only during the safe period. So what is the unsafe period? Maximum fertility occurs during the ovulation. Ovulation usually happens 12 to 16 days before the onset of the menstruation. So 12 to 16 days before the onset of your cycle, ovulation occurs. So avoid sex 2 to 3 days either side. Okay. So because the sperm lives for 2 days and the ovum lives for 1 day. So have 1 day as a cushion period. So 2 to 3 days this way, and that way you have to leave it. So practice sex only during the unsafe period. Practice sex only during the safe period. The unsafe period is during your ovulation. Okay, so 2-3 days this way, and that way you should not have sex. So what are the disadvantages of this method? If cycles are irregular, so as most women have irregular cycles, it is difficult to predict the safe period. So we can go wrong. Illiterate persons, it's very difficult to tell them, and for them to practice it, it's a very difficult method. and compulsory abstinence during the fertile period. Fertile period, either they should have some other method or they should compulsory abstinence of sex during the fertile period. These are the biggest disadvantages. Tubectomy. Tubectomy is another method. It's a permanent method where the fallopian tubes are ligated and sectioned. So this is a permanent method. A lot of women who have finished their family usually go for this method. So what are the disadvantages of this method? It's painful. Any surgery, it is always painful after the surgery. Post-operative, always chances of infection or bleeding are always there after any surgery. So ectopic pregnancy, if the same woman decides to have desired pregnancy, the chances are ectopic pregnancy will happen in the tubes, ectopic pregnancy, and 25 to 30% of people say ectopic pregnancy they have witnessed. So reversal surgery probably not possible, but today with the latest methods, even reversible surgery, they are able to do it. Again, they will open the fallopian tubes. Okay, so reversal surgery probably not possible, but with today's technology, everything is possible. Next one, intrauterine devices. Intrauterine devices means in the uterus a foreign body is kept inside the uterus, so that will prevent from having pregnancy. Okay, so intrauterine devices. So these are the foreign, whenever a foreign object is present inside the uterus, it will prevent the birth of a child. So what are the types of IUDs? 3 types of IUDs have been identified so far. It's called first generation IUD, is called Lippis loop. It is serpentine S-shaped device. All these devices are very stiff but flexible, simple to insert, and they have incorporated with barium. Barium, why? Because if it is lost from that place, we can, by pelvic x-ray, we can know where the device is. They are incorporated with barium sulfate, and also they are non-toxic and they do not react with the tissue. All these IUDs have been made like that. Okay, and they have got nylon threads. Because this nylon threads, a woman can check if the device is in place or not. And if she can't feel the nylon threads, we can assume the device has misplaced from that place. Okay, so the 3 types of IUDs have been made. First generation is the Lippis loop. It is a S-shaped serpentine device. The biggest disadvantage of that is it was bigger in size, and for a nulliparous woman, because her uterus is small, chances of ejection or expulsion are quite high. So they have been modified into second generation of device, that is called copper T device. First one was S-shaped, I said. Second one, they made it as copper T device. It is smaller than that, and the advantage is they have added copper to the device. So that is the second generation device. And the third generation device is, it is again, they kept it as T-shape. Instead of copper, they have used progesterone. So 3 generation IUDs we can say. First is the Lippis loop, S-shaped one. Second one is the copper T, for which copper has been added, that's why the name copper T. Third one is also T-shaped device, but instead of copper, progesterone has been added to it. So these are the 3 devices, and whenever a device is put into the uterus, what will happen? Some morphological changes we will see, because whenever a foreign body is kept inside the uterus, morphological changes means there will be increased vascularity to that area wherever the device has been put. The second one is edema of the tissue will be there, and the third important one is infiltration of all the white cells come there, because it thinks as a foreign body, and neutrophils, polymorphs, neutrophils, macrophages, all they come and accumulate near the device. So these are the morphological changes. Whenever these changes are there, it will be impossible for the ovum to survive. Viability of the ovum is impaired because of these morphological changes, and biochemical changes also, because there will be uterine fluid changes in the uterine fluid. So that viability of the ovum is impaired. And when I say copper ions have been added, copper has got anti-fertility effect. Copper ions, it will inhibit the motility, capacity and viability of the sperms, copper ions. So whenever the copper ions have been added, prostaglandin is also released in the uterus, which will increase the contractility of the uterus. So the nidation of the zygote is impaired. So improper implantation of the zygote. So that is the action of the prostaglandin. And the next one is progesterone. Progesterone also, because I said third generation has got progesterone in it. So progesterone will make the cervical mucus thick. So the penetration of the sperm is made difficult inside the uterus. That is the first action of the progesterone. And also the progesterone, because of the high amount of progesterone in the endometrium, atrophy of the endometrium will take place. So it is unfavorable for the implantation of the zygote. So these are the morphological and biochemical changes. So I've said 3 types of IUDs are there, and whenever the IUD is put, some changes are there in the uterus, morphological and biochemical changes, and I've also told you the action of the copper ions, action of the prostaglandins, and also the progesterone. Whenever the copper T is also there, the motility of the fallopian tubes also increases. So the ovum comes into the uterus even before the bed is laid, and it will have a natural death. So this is also one of the action. So increase the copper T increases the motility of the fallopian tubes. So the ovum comes into the uterus much before the bed is laid for it, and it will have a natural death. So these are the ways how the intrauterine devices act. Okay, what are the advantages of this method? It is simple to insert and safe to use. Visit to the clinic only once. You go and you get it done and come back. 97% is the success rate. Whenever you are planning for a kid, you just remove it, and reversible method. Then you can plan for the pregnancy. Free from systemic and metabolic side effects, because we are not taking anything into your digestive tract like your pills. So if they are free from systemic and metabolic side effects, does not interfere with sexual intercourse. And the biggest benefit of this is whenever you are going to get copper T inserted, time of the gynecologist always checks your pelvis. So if there are anything she comes across, she can alert you. So that is the biggest benefit, and that's the biggest collateral benefit. Whenever you are putting the device, usually the gynecologist checks for the uterus. So that's the biggest collateral benefit. And when should this be inserted? Time of insertion should be during menstruation or within 10 days of the beginning of the menstrual period. Why? During menstruation. Why? Because during menstruation, chances of the women being pregnant are very remote, number one. Or first 10 days of the beginning of the menstrual period, that is the proliferative phase. So that time the cervical diameter, the diameter of the cervical diameter is big, so that technically it is very easy to insert. So first 10 days, and also the uterus is relaxed during this phase. So myometric propulsion for this expulsion of the device are very minimum. So these are the 3 benefits for inserting the intrauterine device during menstruation or within 10 days of the beginning of the menstrual period. I told you what are the 3 benefits. So one is the women being pregnant is very remote because we are doing it during menstruation or within 10 days of the beginning of the menstrual period. The second is her cervical diameter during the proliferative phase is greater than that of your secretory phase. So technically it is easy to insert. And the third is during this phase your uterus is very relaxed and expulsion of the device is bare minimum, because myometrical contractions are very less during this period. What are the disadvantages of IUDs? The disadvantages of IUD is bleeding. So in between the periods, women complains of bleeding. So in women's point of view, it is a nuisance for her to keep changing her napkins. But medical point of view, this might lead to anemia, and you give some iron pills and even then your anemia is not corrected, then you have to remove the device. That is the first one. Second one is pain. So usually women after getting this inserted, they complain of pain, back pain or pain in the abdomen or pain radiating into the thighs. So that pain, so it's very difficult to have that, so it has to be removed. Pelvic infection. It is a consolidated term for acute, subacute, chronic infection of the pelvis, not only of the uterus, cervix, fallopian tubes, connective tissue or the pelvic peritoneum. Any infection can be there, particularly because they said this infection is occurring because of the nylon threads. Nylon threads are the carriers of the infection from the lower to the genital tract. So, and particularly if the women has polygamy, multiple partners, the infection rate is quite high. And if and how does she present? She presents with fever, intermenstrual bleeding, white discharge, or pain during dysuria, pain during urination, or pelvic pain. So that time she should be given some antibiotics. If those antibiotics are not able to bring down the infection, the IUD has to be removed. Next, uterine perforation. This usually happens when an untrained person puts the device. If she doesn't put it into the uterus properly, so this the device can go into the peritoneal cavity and there could be intestinal obstruction. So perforation chances are there when an untrained person puts it. And expulsions. Next one is the expulsions. Particularly Lippis loop, because it was inserted into a nulliparous woman, her uterus is very small. When Lippis loop was inserted, it was expelling it outside. And particularly expulsion is not a problem, but if the woman does not notice it, and it can lead to pregnancy. That is the problem. Expulsions. Ectopic pregnancy. Ectopic pregnancy is quite common with the progesterone property, progesterone device of property, because what do I say? Because progesterone will it will slow down the movements of the fallopian tube. So when it slows down the movement of the fallopian tube, and the pregnancy occurs in the tube itself, because that is the time for the blastocyst formation. Okay, so ectopic pregnancy is more with the progesterone tube. Contraceptive, most popular ones, contraceptive pills. You just have to pop a pill. So classical pill, or it's also called as combined pill, because it has both estrogen and progesterone. It has got active progesterone combined with small amounts of estrogen, and it has to be taken from 5th to 25th day. 5th day means 5th day of the periods. 5th day of the periods, it has to be taken to 25 days. Bleeding on the first day is taken as period, day 1 of the periods. So from 5th day of the period, you keep on taking the tablet. So you will get a strip Mala N and Mala D. One will have only 21 tablets. So you take from the 5th day to 25th, and after you finish those strip, you wait, and the women bleeds within 2 to 3 days after stopping the tablet. So other tablet is there, so that you can continue. You have the habit of taking a pill every day. That is called Mala N or D, I don't remember. But that you take it every day, and last 7 days of that is got with ferrous fumarate, iron tablet. Iron tablet it has got, and so that women will have the habit of taking a pill every day, so that she will not forget it. Okay, so 5th to 25th day. And Mala and progesterone tea, copper tea, they come in the name of Mirena, usually very popular in US by name Mirena, and I think in Australia they call it Skyla in Australia. Okay, so 5 to 25 days you take it, and after withdrawal bleeding, why we not call it as menstruation? because the bleeding is occurring after the exogenous stopping of the hormone. So it is called withdrawal bleeding because incompletely formed endometrium. It is incompletely formed endometrium. That's why we do not call it as menstruation. We call it as withdrawal bleeding because after withdrawing the exogenous hormone what we are giving, we have stopped it. That's why she is bleeding. That's called withdrawal bleeding. It is not called as menstruation. Okay. The next pill, first is the classical pill. The next one is a sequential pill. Sequential pill. How does this classical pill act? Because of this estrogen, how estrogen will inhibit the LH from the pituitary by acting on the hypothalamus. So it will, so this will inhibit the ovulation. That is how estrogen acts. Estrogen acting is by inhibiting the ovulation. So with negative feedback mechanism by inhibiting the ovulation. Sequential pill. Sequential pill contains high dose of estrogen for 15 days followed by 5 days of estrogen plus progesterone. So estrogen, I told you the action of estrogen is by inhibiting the ovulation, and progesterone acts by making the cervical mucus thick. So it is making it for the sperm difficult to penetrate, go through the cervical mucosa. And the second is the progesterone acts because of lot of progesterone in the endometrium, atrophy of the endometrium. So it is unfavorable for the zygote, unfavorable for the nidation of the zygote. And the third one is progesterone will increase the motility of the fallopian tubes, and if at all the pregnancy occurs, it will occur in the tube itself. That is also very dangerous. That is how this progesterone acts. Okay. So estrogen acts by inhibiting the ovulation. Estrogen and progesterone. So these pills act by inhibiting ovulation by suppressing release of FSH and LH. Sequential pill. It inhibits ovulation by suppressing release of FSH and LH. Follicular stimulating. Whenever there are no follicles, that means no eggs also. So follicular stimulating hormone. MINIPILL or MICROPILL. It is low dose of progesterone throughout the whole of the menstrual cycle. So I told you how the progesterone acts. Then post-coital pill or morning after pill. So it is a double dose of combined pill within 48 hours of unprotected intercourse. Double dose means take within 24 hours you take this same pill what I told you in the beginning. What is a classical pill or combined pill? You take the classical pill within 24 hours and you follow it up with take 2 pills in the morning and follow it up with another 2 pills after 12 hours. So double dose of combined pill within 48 hours of unprotected intercourse. Like emergency method, example rape or your contraceptive failure. So you take this post-coital pill or morning after pill. So take within 48 hours 2 doses of combined pill. Okay. So combined pills means once it contains both estrogen and progesterone, and again after 12 hours take another 2. So it is used only in emergency method, example rape or contraceptive failure, or if you have or unprotected intercourse. So disadvantages of contraceptive pills. So thromboembolic phenomena. So progesterone is a proatherogenic. So that is why it might lead to thromboembolic phenomena. Next one, it precipitates diabetes mellitus because it has same action like that of your catecholamines. Catecholamines also increase your glucose level. So same action. So it will precipitate diabetes mellitus and increased systemic arterial BP by their salt retaining properties. Usually taking the pill, edema will be there. So that might increase the BP. So biggest disadvantage of this pills is thromboembolic phenomena and diabetes mellitus and hypertension. So one thing about this intrauterine devices also, every 2 to 3 years they need to change that device because the efficacy will decrease after that period, and also if you keep it like that for a long period, chances of infection are there, and it might make the women permanently, it might block the fallopian tubes and render the women permanently childless. Injectable contraceptives. These are the synthetic drugs like progesterone, called as depot formulations or slow releasing formulations. They are called depot formulations or slow releasing formulations. Only progesterone is used in this nowadays. This is the in thing. Lot of people are using this. So they come in the market in two ways. DMPA, depot medroxyprogesterone acetate. You take this injection once in 3 months. Each dose contains 150 micrograms of progestin. So all these are synthetic progesterones. You take this once in 3 months and you are safe for 3 months. The women can't conceive. So other injection in the market is NET-N, norethistyrone enanthate. It is also given IM once in 2 months. It is given during the first 5 days of the menstrual period, because first 5 days remote. Why first 5 days? Because women being pregnant are very remote. So that is why first 5 days. And pills, the biggest advantage of giving progesterones is it will not interfere with lactation. Whenever estrogen is there in the pill, it interferes with lactation drastically by as much as 40%. So advantage of having progesterone is does not interfere with lactation. If the mother has got a kid and she does not want a second child soon and she is breastfeeding the first child, she can go for this injections, progesterone injections, because it does not interfere with lactation. Disadvantages are menstrual cycles become irregular. So as long as this injection if the injection lasts for 2 months, you may not get period in those 2 months. If the injection lasts for 3 months, you may not get the period for 3 months. So, and weight gain is the other disadvantage of this progesterones. And nowadays, some people are taking subcutaneous implants. So, this has also got this progesterones. 6 small silicone rubber soft capsules of 35 micrograms are inserted subcutaneously under local anesthesia into the arm or forearm of a woman, and after they are inserted, they are like matchsticks. After they are inserted by adhesive bandage, it is covered, and the women, and this can last for 5 years also. So some busy women, so who do not want for a longer period, and this is the contraceptive they are going now in the Western world, subcutaneous implants. So for 5 years it can last, and whenever, as soon as the implants are removed, she can conceive within 5-6 months. Effect is reversible. Biggest disadvantage is it is a surgical procedure. You need to go to the theatre under local anesthesia. It is done, and these capsules are inserted into the arm or forearm subcutaneously under LA, and irregularity in periods will be there. So these are the disadvantages. But slowly these implants will absorb slowly into your this medicine is absorbed by the body. And nowadays vaginal rings are also worn. This vaginal rings, same medicine like the subcutaneous implants, but it is inserted it's in the form of a ring, and it is inserted into the vagina. It is worn for 3 weeks and is removed in the 4th week. The advantage of this is because through the vaginal mucous membrane, the medicine is getting absorbed and it will bypass your digestive system and the liver. So side effects are not there. So it is worn for the 3 weeks and removed 4th week. Okay. Failure rate per 100 women per year. So what has got highest failure rate is rhythm method. 15.5% is the highest failure rate. Next comes Coitus interruptus. 6.7 is the failure rate, and the best is classical pill or combined pill, 0.25. Classical pill or the combined pill, 0.25, which has got both estrogen and progesterone. That is the best method. Okay. So lipiscope is 1.3 and copper T is 1.5. Okay. So these are the failure rate per 100 women per year. So how they look like? The first one is the diaphragm or cervical cap. The second one is this jellies and paste on the cervical cap. This one is the copper T inside the uterus. That is the condom, vasectomy, pills. That is the tubectomy. So these are the different methods. So we have seen that what is contraceptive method, what are the different methods used by men and women, and we have seen the advantages and disadvantages. We have seen the mechanism of action, how they act, and that's how they inhibit the pregnancy. So that's about contraceptive methods. Okay, that's it from me.